and welcome to El Camino College's COVID-19 educational session. In this presentation, we'll go over COVID-19, prevention, mythbusters, treatment, personal responsibility, and before campus arrivals. The sportswear section will be covered in another video. COVID-19 is a virus derived from the coronavirus and is a large family of viruses common in both people and animals. COVID-19 is caused by a virus that has been named SARS-CoV-2, which is the same family of viruses as SARS and MERS. COVID-19 is a respiratory disease that is being spread by a new coronavirus that emerged in the year 2019. It affects both the upper and lower respiratory tract. It is a virus, meaning that there is no medication or drug to cure COVID-19. Medication can only be used to treat symptoms. Signs and symptoms of COVID-19. The most common signs and symptoms are listed below, but not limited to cough, fever, repeated shaking with chills, headaches, loss of smell, severe vomiting, shortness of breath, chills, muscle pain, sore throat, loss of taste, and diarrhea. High-risk individuals. Just because you are not in the high-risk group does not mean that you cannot contract COVID-19 and suffer complications. Everyone can contract COVID-19 and transmit it. The CDC defines the high-risk individuals having these conditions: chronic lung disease, moderate severe asthma, those with severe heart conditions, for example, coronary artery disease, congenital heart disease, and cardiomyopathies, immunocompromised individuals such as those suffering from HIV or AIDS or undergoing cancer treatments, severe obesity, diabetes type 1 or type 2, chronic kidney disease, and liver disease. So if you have any of these conditions, you are a high-risk individual, and we will have to go over with your doctor and get you medically cleared to participate in practice and competition. People who are more likely to suffer severe illness from contracting COVID-19 are those 65 years or older and those living in nursing homes or long-term care facilities. Note, many of you may live with or know or come into contact with these high-risk category people. So just make sure you know who you're with and the risks that come with it. Complications of COVID-19 that can affect multiple systems in the body can include but are not limited to acute respiratory failure, acute respiratory distress syndrome, viral pneumonia, acute kidney injury, acute liver injury, secondary viral and bacterial infections, septic shock, and abnormal blood clots, which can lead to pulmonary embolisms or a stroke. COVID-19 transmission can be transmitted from person to person. For example, between people who are in close contact with one another, respiratory droplets produced when an infected person coughs, sneezes, or talks or sings. Droplets can land in mouths or noses of people who are nearby or possibly be inhaled into the lungs. And COVID-19 can be spread by individuals who are not showing symptoms or asymptomatic. Contact spread can also be a form of COVID-19 transmission, and this is, for example, by touching a surface or object that the virus is on and then touching their own mouth, nose, or eyes. And the amount of time that the virus can live on surfaces depends on the material of the surface itself. So on plastic and stainless steel, about 72 hours that virus can live on that surface, less than 4 hours on copper, and less than 24 hours on cardboard. Prevention. I'm sure you've all heard this a lot, but we're going to reiterate it. Avoid large events and mass gatherings. Avoid contact 6 feet apart with sick individuals. Wash hands often with soap and warm water for 20 seconds or use alcohol-based sanitizer made with at least 60% alcohol. You're going to avoid touching your mouth, eyes, and nose. Avoid sharing personal items like water bottles and towels. Clean and disinfect high-touch surface areas as needed, such as tables, doorknobs, desks, and sports equipment. And avoid going to work, school, and gatherings if you are sick. Again, avoid going to work, school, and gatherings if you are sick. Number one prevention for making sure that contact surfaces remain clean and you remained preventing COVID-19 is proper hand washing. So again, that's 20 seconds minimum with warm soapy water. How to properly wear a face mask, guys. We want to make sure that that mask is over your nose and your mouth. and do not touch the mask while doing it. If you do, wash your hands. You're going to remove the mask from behind by holding the strings with clean hands. So if we see that your chin is exposed or your nose is exposed, we will ask you to properly put on your face mask. COVID-19, the flu and allergies sometimes have some overlapping symptoms, and here is a chart of the differences between the three. So the coronavirus, you typically have a fever, cough, shortness of breath, or difficulty breathing, and the symptoms appear 2 to 14 days after exposure. Now the flu, yes, you may have fever and cough, muscle aches, fatigue and weakness, chills and sweats, congestion and sore throat, and allergies or hay fever includes sneezing, itchy nose, eyes or roof of the mouth, runny or stuffy nose, and watery red or swollen eyes. The main thing here to take away is that if you are symptomatic with the symptoms listed in our symptom checklist, do not come to campus and let your coach and or the athletic training staff know. Again, if you are symptomatic, do not come to campus and let your coach and athletic training staff know. Mythbusters. So there is no cure for COVID-19. However, there are vaccines created as of recently that help prevent the probability of contracting and the transmission of COVID-19. We highly encourage all student athletes to get the vaccine, Moderna, Pfizer, or Johnson & Johnson. Adding pepper to your soup or other meals does not prevent or cure COVID-19. COVID-19 is not transmitted through houseflies or mosquitoes. Spraying and introducing bleach or other disinfectants into your body will not protect against COVID-19. Drinking methanol, ethanol, or bleach does not prevent or cure COVID-19. Cold weather and snow cannot kill the new coronavirus, nor does high temperatures or humid environments do not prevent the spread of COVID-19. And drinking alcohol will not prevent against COVID-19. So put those myths to bed. Treatment. What if you get sick? Number one thing, stay home except to get medical care. Most people have a mild illness and can recover at home. Do not leave unless it is to seek medical care. Avoid public areas. Get rest and stay hydrated. Take over-the-counter medicines, for example, Tylenol or acetaminophen, to help with symptoms. Stay in touch with your doctor and avoid public transportation. If you get sick, please separate yourself from other people as much as possible. Stay in a specific room and away from people or pets in your home. If you must be around other people, wear a face covering. And it is recommended that you quarantine for 10 days after the onset of your first symptom and then get tested. For El Camino College, we will only accept PCR tests. Okay, so if you do get sick and you quarantine for the 10 days and need to get tested, just remember PCR tests, not the antigen or rapid tests. Treatment. Monitor your symptoms, keep track of all your symptoms, and be aware if they worsen. If they do worsen, or if you believe you have an emergency warning sign, seek medical attention right away. Those emergency warning signs or symptoms are trouble breathing, persistent pain or pressure in the chest, new confusion, the inability to wake or stay awake, and bluish lips or face. Personal responsibility. If you are sick, guys, even if you think it's a cold, stay home and stay away from the teammates and the school. Notify your athletic training staff and coaching staff about any illness or exposure that may have happened. This is important here, guys. That is your personal responsibility. If you get sick, let your coaches know, let the athletic trainers know. Sneeze and cough into your elbow or tissue. Wash your hands often or use hand sanitizer if soap and water aren't available. And wipe down high-touch areas such as doorknobs, cell phones, tablets and tables, and any practice and game equipment, though you will not be coming to campus if you are sick. Wear a mask if you must be outside while sick. Ensure that the mask covers your nose and mouth. And be honest about how you're feeling and who you've been into contact with. Follow rules and restrictions of the athletic training clinic at all times, and when in doubt, ask. Okay, so that concludes our COVID-19 educational presentation. The next video that you will watch is an instructional video of how to complete sportswear.